Now let's look at what flattened curves look like across multiple countries on the same screen. So let me quickly show you. This is a New York Times piece. And what you see here is you got a nice looking chart. Again, this is grain of salt if you believe the data from these countries. You see China really dropping it down. Although having a little bit of a spike here, God knows what's going on. Hopefully this isn't one of those things that's just like whack-a-mole. Italy has come off its peak, but this is not a fast downward sloping curve. And then US, we're still climbing the mountain. We're not on the other side of it yet. And then if you look here at other countries, Spain, Italy definitely has come off its peak. Germany, decent. Everybody's still early days. You can't look at one of these. Look at the Iran death rate looks a little bit more encouraging. But you can't look at any of these countries and say, wow, they're out of the woods. Switzerland. Switzerland seems to have flattened and actually brought it down a bit. I can tell you I live in Switzerland, and what they're doing is they've shut down all but essential businesses. So basically just groceries and pharmacies are open and restaurants for takeout. But it's funny, my brother, who's a bit of a prepper and is very, in my opinion, kind of alarmist about this Corona stuff, still went to Best Buy last week because he needed a printer. So that's the difference. Like, there's no way the equivalent of a Best Buy would be open in Switzerland. But, every country's handling it different. And then you look at this, like Pakistan, if you were in Pakistan, you would think they had it under control. And then, bam, a second wave. That's the risk. Look at Denmark. You would think Denmark had it under control here. And then, bam, Japan, off the peak, bam. So, guys, if you're listening, as soon as you start seeing those U.S. numbers come off their peak, don't assume that we're out of the woods, because it looks like many countries have this little resurgence. Qatar, oh yeah, off the peak, boom, another one. So, Jesus, look at Kuwait, off the peak, everything's great, boom, off the peak. Things are getting better. Boom. So, yeah. Gosh. What country has the best looking chart so far? I would have to say it would be the South Koreans. Look at that. That's what you want it to look like. So massive. Actually, we should go back to that article where we talk about what South Koreans did, because the Singaporeans, they had a little bit of a surge. Let's look at what the Singaporeans did. What the South Koreans did. Hold on, we'll go back to the South Koreans now, because they do have the nicest looking chart. So what is the South Korean formula? Okay, so they knew of this thing because they apparently, there was a religious group that traveled to Wuhan to purposely infect themselves. Jesus. The government tracked them down. The sect's leader apologized, and then public health officials were able to contain and mitigate spread. Can you imagine some religious leader saying, yeah, let's all go to Wuhan to purposely infect ourselves? Like, whoa, why would you do that? It's just not scientifically sound behavior. Anyway, so then the they prepared hospitals for the surge. By the time you detect the virus in someone, it was something they caught a week prior. So the spreading is a week old. You have to do something that prevents infections next week, not last week. So it's not a sprint, it's a marathon. Detect cases early because it's harder to contain a big number of cases, according to Vernon Lee. This is a Singaporean, but where's the South Koreans? This article is kind of lame. Okay, here we go. The South Korean model is an invasive Big Brother approach, easier applied in local hotspots rather than in large states. Public awareness of the disease in South Korea pushed more people to get tested. If they tested positive, it did not mean they got sick, but they were tracked and quarantined so as not to infect others asymptomatically. They did more screenings than any other country at a rate of 10,000 per day. Okay. That's an interesting sneeze. This guy's quite powerful. Think that means he's got 5 meters of reach. It's probably saying a woman wearing a face mask as opposed to showing preventative measures. That's another thing. Remember, the U.S. guidance was that face masks were not useful and not necessary. That was a load of malarkey. At any rate, yeah, I don't know. I don't know that the South Koreans have any special formula other than just testing and covering people down and isolating. So, at any rate, okay. Let's see here. Oh, my chats have stopped refreshing. So I'm going to quickly go and open another window so I can keep track of our conversation before I go on to my next chart. Let's see here. Pop out chat. There we go. Actually, I don't want to pop it out. Oh, now it's done. Okay. All right. So that's the beautiful South Korean chart. Let's just take another look at their chart, man. That's what we want. We want this chart. That's what we want. That is not what we have now. Most of the world does not look like that. Most of the world looks like everybody's just climbing or getting the whack-a-mole bump. Either way, early days on this one. All right. Now, let's look at certain states of the U.S. And see how, like, New York, Kansas, California, those guys are doing. Let's go back here. So if we go to the U.S., we've got the most cases in New York, New Jersey. Oh, Michigan popped up to number 3 now. California, Louisiana, Pennsylvania. Those are some of your hotspots. And in terms of new cases per day, similar list. Yeah, New York is still having the most growth. Then New Jersey, and then Pennsylvania, Louisiana, Michigan. Total deaths is New York is at 7,000. They added about 800 yesterday. So they probably will be hitting 10,000 deaths in New York in a few days. Now, if you look at the total cases per million people, New York, New Jersey, Louisiana are the most hit. But there's some other states that aren't getting talked about that have pretty high levels of cases per million. Like, as an example, people with the least cases per million are Puerto Rico, Minnesota, West Virginia, a couple hundred. But like Massachusetts, Connecticut, DC, Michigan, Rhode Island, these are over 1,000. In the 2,000 and up range. And then if you look at the so anyway, that's the state by state breakdown. Someone was asking about Kansas before. Let's see what Kansas looks like. Kansas, 300 cases per million is well below average. So looking good so far in Kansas. All right, so that's the US stuff. Next thing I want to show you guys. Ooh, yeah. I've got some more, some interesting charts on growth by metropolitan area over time.